So I think that's a really interesting discussion, and we'll go to some questions. Beatrice, Kira, and my third panelist, my first panelist, sorry, Camila. We'll go back to some of the questions that have been forwarded into the chat, and thanks to Mark for forwarding those. There's some questions for all here. I think some of the questions have been answered that I've been picking up in the chat have been answered through the presentations, and then others have kindly offered answers in the chat. But we'll come back to some that have not been. I think the first question is Beatrice and Guy for us. What lessons learned during COVID pandemic could be applied to long-term management of NCDs? And I think you've touched on some of them, but it's really about that integrated approach, service delivery, integrated service delivery, and at primary healthcare. One of the main unacceptable lessons, or sort of painful lessons learned in COVID, is that almost 80–90% of services to manage, control, prevent NCDs were interrupted during COVID situation because there was not necessarily the adequate integration between the health system strengthening. Do we understand NCD in primary healthcare, and really also insert attention to NCD management and control in emergency preparedness and response plans? So that was completely pivoted, obviously, towards communicable and COVID and pandemic responses, which did not at all include or have in the radar the attention to NCDs, necessary attention. So that's part of the integrated approach, which Beatrice, you touched on. So the need to, zooming in on a diagnostics element, lessons learned in COVID, the need to maybe ensure that we are integrating into powerfully and resourced and strong frameworks in other programmatic areas. Any comments on that?
Yeah, no, thank you. To me, I think what we really learned with testing in COVID is meet people where they are in daily life, right? I think this is sort of the taxi rank has shown that quite nicely, that this is their people's first priority, go about their daily life and earn their income, or do what they need to do every day. And that's where we need to meet them with those screening approaches. And it's not only through integration, but of course also there could be other activities that have nothing to do with health. Like, for example, we see often in the monthly cycles when people go and get their pension scheme payment, then they queue up somewhere. So that's an opportunity to come. But also importantly, what we learned in COVID, couple it with education, right? We saw so much education during COVID in terms of symptoms, washing your hands, wearing your mask. So it's that was critical and simple messages, right, to people to understand. And I think particularly for NCDs, it's important because there are so frequently no symptoms, and that's when we need to identify people, right? When they have the condition yet have not developed symptoms, which are often based on serious complications that are happening. So couple good education about why NCD is early NCD screening and testing important in management, and then meet people where they are, in terms of screening.
Absolutely, and that probably links to the participatory approaches. How we're really engaging the communities, individuals in revisiting health responses and readapting as we move into emergency situations or otherwise. And I think you mentioned health literacy and communication, but there's this really also unfortunate understanding of misinformation during COVID and how that impacts the ability of individuals to access, understand, or request adequate attention and service delivery. So I think that's something we also have to address. That's a nice, important lesson in the situation. I don't know if Kira or Camila, you want to add to that in a particular element? We have questions for you, so maybe you want to concentrate on the questions. There's one for Kira. What impact, in particular, the last one I think is interesting, was that will WHO Kira develop a new technical guide to implement the social participation handbook?
Yeah, thanks, Guy. And just maybe to echo, I very much agree on the point that you just mentioned on the misinformation, and I think that's key, and that's actually linking also to the participation. But to your question now, so the WHO handbook on social participation is the normative guidance that stays there. What I was reflecting to is that we will develop some more operational tools. There will be also work that we have started in terms of developing a monitoring evaluation framework on social participation, understanding better how to measure social participation. So again, a lot which is drawing from the WHO handbook, but also from the other guidance and tools that have been developed by WHO. Guy, you very well have been involved with the WHO framework on people living with NCDs, etc. So we have been collaborating and drawing from the various guidelines and frameworks that are available. But in this case, it is very much from the operational tool. We understand it's a 200-page document, a lot of rich information, but it's also in order to translate some of these a recommendation into operational tools, guidelines, and link to that actually also a note that we are in the process of developing an e-course as well in order to include and strengthen the capacities forward. So not a new normative guidance, but more fine-tuned opportunities and tools for different actors to use in their efforts and endeavors to strengthen social participation.
So additional support to countries. Nice, excellent to know. That just underscores again WHO's commitment. We're sustaining our commitment to support countries in this point forward with additional support. There's a question on how we're supporting countries necessarily implement. I'll get to that, but I want to come to Camila. There's a question for you, Camila, which is if you can pinpoint to some of the recommendations in the Brazilian food guide, point to sort of, I think, food systems and how we're fighting obesity. We were talking about systems approach that has been supporting, that is the foundation of the Brazilian food guide. How is this addressing food systems in the realm of obesity? Unmute.
Yeah, I was unable to unmute. Thank you. So I think that the main recommendation of the food guide in terms of changing food systems and food environment is to avoiding ultra-processed food. And this is a very innovative approach when it came out because it isolated a group of foods that was driving the increase of obesity and non-communicable disease. And on the other side, it highlights that diverse diet and which is already practiced in Brazil is a healthy diet. So by isolating this group of food that is driven this disease, it's a very innovative approach compared to nutrient, the previous food guide that was focused on nutrients, because we can then formulate policies to change food environment and food system.
Thanks, Camila. That's excellent. I think Mark also points to another publication study. I'm not sure if it's part of the guide. Mark, thanks for that. There's a link in the chat for more information on that. I'm not seeing necessarily others. I will pick up another one there that says, how are we supporting countries in community engagement? I think that's extremely important because the social participation handbook and the framework are excellent frameworks for the situation and the principles, the actions, the enablers to move forward in meaningful engagement. But ultimately, what are the actions? What are the interventions required? There's sections in the framework that point to the actions, specific actions, or just a menu of options. And ultimately, it is when we get to the ground, we get to the countries, we sit with countries, understand what is the prevalence, where are the gaps in interventions, which are, for example, some of the best buys that are not necessarily being completely contextualized and having the impact that we know they have, and having impact with some of the communities and not contextualizing and adapting to the needs of the communities. So really is when we get to the ground to understand how all this framework of actions, enablers, and interventions come together to support, for example, cancer agenda, cancer control. And we're doing exactly that in the EMRO region, Eastern Mediterranean region, where we're launching a project. We've launched a project to support 6 countries. Each country will have to define a particular area in cancer control, which would benefit from a co-creation, participatory, meaningful engagement of the experience, and we're putting together the whole multi-stakeholder environment to do so, dialogues, consultations, looking at the policy cycle, where in the policy cycle we'll be doing certain meaningful engagement, and then certainly measure and assess how that has enhanced impact, scale, and certainly reach of some of these interventions. So I think we are moving to that. That's the first example of the pilot in one region. We're moving to the region, but very important. All of this does not make any sense until we go to the ground, in a sense, and understand how we can implement and support countries contextualize these tools and these products. I'm seeing one more message, question here. I'm picking up. There's a question, Beatrice. There's two now touching on the. I'll look at the first one first, but it was the trust or the reliability on point of care diagnostics.
Yeah, absolutely. And I've just put a reply in the chat with a link. So, I mean, there are many point of care devices, right? There's no lack of point of care devices being developed. Many good ones, but many also with questionable performance. So I think the key message is independent evaluation is critical. And I'm not saying everybody needs to do a big study, but certainly when you start using a point of care device, do a validation, right, within the facility, if possible, before making the commitment to a certain device. You will see in the podcast, my colleague, Dr. Priyanka Singh, is presenting at a diabetes conference evaluation of 10 point of care HbA1c glycated hemoglobin devices. And there's particularly one image that is very striking where there's an international categorization of performance, gold, silver, bronze, standard, and the 10 devices have a very big spread. There are some in the good categories, but worryingly so, there are some in the very bad categories. So I think it's what we at FIND try to do is to analyze, generate data, because we appreciate that not everybody has the means and the ability to do it locally, so people can make informed choices. And even if the manufacturer has very good data to demonstrate, to show, validation is so critical, because otherwise trust is eroded. If a product is bought because it has a low cost, and then the clinicians realize actually the performance does not match with the clinical symptoms or with the history of the patient, then the trust is eroded, which makes adoption of point of care testing even harder, even for the good devices.
And then we invite participants to look at that link there with more information. I think we've sort of addressed the main questions here, and I think there's much more we can discuss. I suppose, Mark, that you don't mind that we make ourselves available for any follow-up questions or references needed or follow-up material that participants may need. We're available for that, and we will share the slides. I'm sure that the panelists have no problem in we sharing the slides, right? Excellent. We'll share the slides. We have more information and references. I think we'll be closing the panel. It's an excellent discussion, and I hope the purpose of the panel was clear. We want to spotlight some clear accelerators. We need to catalyze action quickly. We need to understand where the main pain points. These are 3 pain points that we are clearly identifying and already finding solutions, joint solutions, collaborative solutions with WHO partners and member states, Brazil itself. So I think we can much lessons learned here. All 3 of these particular areas are part of our reporting in our support to that 4th high-level meeting on NCDs. As WHO, as the leading technical agency, we are supporting the Secretary General in New York and the President of the General Assembly in that process to sort of scope, design, negotiate, and confirm a political declaration, which will happen next year. During next year, in April, let's say, to September, we'll be supporting member states in the General Assembly shape that political declaration. These 3 are certainly important priorities in that discussion, and we are providing this evidence, outcomes of this discussion, and some of the references and data that we've been hearing today. We'll be providing into that process in addition to other areas. But I hope this is useful to understand that we are all collaboratively working on some of these pain points. We are addressing the health inequity issues in the NCD agenda, which is extremely painful to see. We've seen 3 examples of where that is happening. And we are really identifying vulnerable population. We are defining the NCD, those living with NCDs, as the vulnerable population. That's the lesson learned from COVID. Really underserved, and they do present more vulnerabilities to infections with COVID. So NCDs is a vulnerable population. There's huge pockets of underserved NCD communities, which we need to address. So this is a small spotlight on what is possible, what is feasible, and hoping to provide you with more in future sessions. Thank you so much, Mark, for inviting us and myself in the panel, and looking forward for any follow-up.
Thank you.
Thank you very much.
Thank you.
You're muted, Mark. Right.
I'm
Your turn
sorry.
to be muted.
Thanks a lot, Guy, Beatrice, Kira, and Camilla. It was a very rich panel with some information that will for sure help the discussions here. So we'll provide so much for our participants, our members and network to to go ahead and reflect and plan their activities, their work here in Brazil. And I'm sure that since global audiences also watching us through YouTube, also they have a great time watching this panel. Thank you very much.